There's no question that that community suffered significant contagion in this second wave.
COVID-19 has been relentless in Montreal's Outremont borough with one of the highest infection rates in the city. Montreal Public Health is now working to stop the transmission of the virus by engaging with community leaders, especially the Jewish community, since the area has a large population of Hasidic Jews and it was recently high holidays.
And we continue to be stubbornly loyal to our traditions and our faith, coming together to pray, coming together to celebrate, coming together to give each other comfort in times of need. And it is very difficult for us to rewire our hard drive on a dime.
In the past 2 weeks, the borough has seen a rate of 329.8 cases per 100,000 people, one of the highest in the city.
Part of the reason is population density, multi-generational families, very large families living in close quarters.
We brought that to the table and said, well, what's happening here and what can we do about it? And with community leaders, I think that's how we're able to get that under control. And what we see now is that transmission appears to be decreasing in Outremont, and we hope that we see that same trend in the other neighborhoods.
The borough wasn't a hotspot during the first wave, but an Outremont man, part of the Hasidic community, was the city's first recorded death linked to the virus.
There are certain dynamics in that community that certainly expressed itself in the spring where they didn't have access to the information they needed. The Quebec government has radically changed its approach to the ultra-Orthodox community for the first time, I think, in history. Information was sent out in Yiddish by the Quebec government, which is interesting. And they are trying very hard to communicate. They're in constant touch.
We have a team that includes people who are working on the schools, people working on contact tracing, myself, who I'm more on the environmental health side. But on the ground, the best placed people to do that work are people from the community.
Outremont resident Astrid Arame founded the COVID-19 Help Hub during the first wave, backed by the borough and Centraide, helping out the most vulnerable.
We ended up mobilizing around 65 people, in different various teams of people that did outreach and people that did phone calls, coordinating, volunteers doing shopping, volunteers doing deliveries.
The steps we have to take to lead an abnormal life in order to stay healthy are the steps that must be taken by all.
In Montreal, Alyssia Rubertucci, City News.